There are concerns that there are gaps in our mental health system, the system that is so vital in a post-COVID world. Young people are especially vulnerable, and this is after experiencing extreme social isolation during the pandemic, not to mention the current challenges posed by the rising cost of living. Throw social media into that as well. So, how is government faring? Is this a political issue? And what do voters think? Joining me now is Redbridge Group Director Simon Welsh. Simon, thanks so much for your time. Looking at the events of the last fortnight, I think there is a threat of fear, particularly in the community I live in, but this has, I think, rocked everyone in Australia, given the just unfairness and how unfathomable it all was. Is there now a renewed focus among voters when it comes to mental health?
Yeah, thanks, Laura. Certainly, yeah, the Bondi events and the events in Western Sydney have really been the latest layer on a cake that's been baking for a very long time around mental health. And the Bondi issue, particularly among women, we're seeing a real anxiety and a real concern around that, and concern around mental health. But as I say, politically, it's the latest layer on this cake that's been baking for a very long time. So, if we think back to that fairy tale land known as before COVID, mental health was coming up a lot in focus groups in those days, really framed around service deficiencies, can't get access to the services you need, and those sorts of things, the cost of services, the lack of psychologists. All these issues were coming up pre-COVID. That hasn't gone away, but what keeps happening is new layers get added to this mental health problem that makes it a political issue. So, then through COVID, as you pointed out in introduction, that the stress and strain, the social dislocation of COVID added to the concerns around mental health. Those problems haven't gone away. That layer is still there. In fact, they've sort of been amplified by cost of living, which brings pressures in its own right, but has also sort of prevented people from healing, from reconnecting with the lives that they had prior to COVID. For most of us now, our lives are very different to what they were before COVID. And that itself creates sort of an anxiety. It creates a sense of loss, a sense of grieving. So all these things keep getting added to the cake. So when you talk to people now about, say, cost of living, that conversation over the last month or so has increasingly become a conversation about mental health. And it dredges up all those previous layers when you're talking about it. So what I think, it's an issue, absolutely it's an issue in its own right, but I think the real sort of political pain of the issue, if you will, is the lack of hope that it symbolises, the lack of hope that's encapsulated in the issue. So, people have no sense of sort of where we're heading as a country, and it plays across a variety of policy issues, which, you and I have talked about, which is, this sense that the electorate has, there's no sense of an economic plan for broad economic plan beyond some tax cuts around cost of living. And other issues, there's no sense of a plan around climate. These things matter emotionally, and it's really coming home to people and we're seeing it in this call for greater mental health supports, greater mental health services. Yeah. Yes, those things are important, but it is also just symptomatic of a broader sense of a lack of hope.
I think so as well. And I remember at the time there was one of the first decisions this government actually made was to reduce the number of psychologist visits that you could get a rebate for. That now, in a new light, I mean, at the time it looked like a bad decision. That now looks like, the government didn't get it and doesn't have its priorities wrong. So I guess they've got to make up that ground as well.